what treatment options are available currently?
Okay, so the treatment for lymphedema is quite broad. The gold standard internationally, to start off with, is via a lymphedema therapist. These are ladies that go for special lymphedema courses to manage lymphedema, but essentially it's compression and lymph massage and special exercises to help the arm cope with the excess fluid. That's the conservative component in terms of treatment. All of our patients get referred to a lymphedema therapist to start the process. They also help us with pre-operative and post-operative special programs to get them ready for surgery, as well as post-op to help with the lymphatic management post-op. In terms of surgical options, initially the surgical components were left for sort of like as a last resort. Currently the thinking is to start with the surgical component as early as possible. Depending on the results of the scans, we can determine what kind of issue there is in the particular limb. And essentially it's divided into physiological options and debulking options. So as sort of the name says, the physiological options tries to create a normal situation in the limb where you help the body deal with the fluid. So under that, we create the one is called LVA, or lymphaticovenous anastomosis, which essentially is creating little diversions from the lymphatic component, which is obstructed, into the venous component. So it's little bypasses or little diversions to help drain the fluid. And that's the one component. The second component is to transfer lymph nodes that are functional. So we harvest healthy functional nodes from somewhere else in the body. It can be from the groins or the neck, and there's a few other options. But essentially we remove those lymph nodes with a little bit of fat and skin, and we do a tissue transfer onto the limb where we implant those nodes. It makes new connections with the lymphatics around it, and over time there's new lymphatic connections that form, and that helps to drain the lymphatic fluids in the limb. So that's sort of the physiological components. But not all patients are candidates for some of these, and that's why we need the scans to determine which ones can get the lymphaticovenous anastomosis and which ones get the lymph node transfer.